Hello guys, today we are going to discuss about a laboratory test. It can be called as a molecular test. Name of the test is Clopidogrel. Another name is CYP2C19 Genotyping. Use of the test to help evaluate your likely response to the antiplatelet drug Clopidogrel by detecting variations in the gene that codes for one of the enzymes that metabolizes the drug. Clopidogrel is prescribed for people who are at risk of heart attack or stroke to help prevent harmful blood clot from forming. This test helps determine if a person may be less responsive to the drug clopidogrel because of his or her genetic makeup. This test detects genetic variation in the gene CYP2C19. A healthcare professional may sometimes request this test to determine whether clopidogrel will be effective for the persons tested or if another drug for treatment may be required. Clopidogrel is a drug that is part of a group of medications called antiplatelet drugs and is used to prevent strokes and heart attacks in people who are at increased risk for these serious cardiovascular events. The drug works by helping to prevent harmful blood clots from forming by preventing platelets from clumping together. Normally, when an injury occurs to blood vessel, platelets in the blood stick to the site of injury and clump together to start the formation of a blood clot and help stop the bleeding. In people at increased risk for the heart attack or stroke, this process can occur inappropriately. So, they may be treated with a drug that prevents platelet aggregation. Clopidogrel is given in an inactive form and must be changed by body to an active form before it can be effective. Some people who have some genetic variation in the gene CYP2C19 do not metabolize clopidogrel to its active form, as well as people who do not have these genetic variations in CYP2C19. Therefore, individuals with CYP2C19 genetic variations who are taking clopidogrel may not receive adequate benefit from the drug and may be at risk of having a heart attack or a stroke. This test identifies people who have one or more CYP2C19 variants. Each person receives one copy of their genes from their mother and one copy of each from their father. Thus, CYP2C19 gene is present in the body as two inherited gene copies. Any person could have both copies of a gene without any variants. One copy without variant and one copy with variant. Both copies with the same variant and both copies with different variants. The combination of CYP2C19 gene copies that a person has can determine how effectively clopidogrel is changed to its active form in the body and its overall effect. Clopidogrel responsiveness testing determines whether CYP2C19 gene variant are present. Careful interpretations of the results can help the healthcare provider decide the appropriate platelet treatment for the person tested. Sample required blood. Normally, it is not required. This is about clopidogrel